Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare.
Well, we're talking today about peripheral neuropathy, causes and treatments. This is part 2 of a 2-part series. And we did part 1 last week. And there's so much information out there with the peripheral neuropathy that we needed to do a part 2.
Sure.
So let's just recap, Dr. Prather. How many people are affected by peripheral neuropathy here in the United States?
There's 20 million people who are diagnosed with peripheral neuropathy right now, so which is a very large number. There are quite a few people who have some form of peripheral neuropathy that hasn't been diagnosed, even a low level.
So it's probably more than
It's
20
more
million.
than that. People who are starting to, one of the things we do is some screening for that so that we can catch it before it becomes a problem. So we do different types of screenings along those lines on people I have suspicion of, and most of them are starting to develop some peripheral neuropathy, though it hasn't been diagnosed. So the number of people who really need to have that looked at, treated, are much higher than just the 20 million people who are diagnosed with it.
Okay. Well, let's talk about the causes of peripheral neuropathy.
There are several different ways that you can get peripheral neuropathy. There are over 100 different types of peripheral neuropathy right now.
Wow, 100?
That have been put down. So some of the causes can be an infection. Diabetes, of course, 70% of everyone who is diabetic has peripheral neuropathy. So diabetes is one of the major things, but it can also be kidney disease, liver disease could also kick that off. Nutritional deficiencies has a lot to do with it. Some of the other things that can kick it off are smoking, obesity. In other words, there's quite a few things that can cause it. Chemo. A lot of different types of drugs can kick off peripheral neuropathy. So being aware of all those different types of things, anything that can cause damage to the nervous system winds up causing peripheral neuropathy.
Yeah, because it's interesting. I was just always thinking diabetic,
Sure.
Which you say 70% of people with diabetes
Has
have
peripheral
neuropathy.
Right.
But it's much more than that.
Yes.
Interesting. Well, let's talk about, the different types, and then we'll focus on the diabetic neuropathy.
Yeah, we divide them up into the 3 major types are what are the different nerves that are affected by that. Because you have 3 different types of nerves. You have autonomic nervous system nerves, you have sensory, and you have motor. So establishing which one of those has been damaged by the peripheral neuropathy, and it could be all 3 or 2 or just one. So one of the things that we do is do tests to find out which nerves have been affected, and then concentrate on those.
So at the Prather practice, you know specifically which
one is involved
nerves.
with that? Yes.
The treatment will be different?
There are different ways that we treat that. The other thing, of course, is it can be involved with circulation. So part of the thing that we do is people who are diagnosed with peripheral neuropathy, we also establish whether it's a circulatory problem or a neurological problem.
Okay. Good. Well, let's talk about diabetic neuropathy. It's the most common form, of peripheral neuropathy. Why is that?
Well, when you are diabetic, one of the major things that occurs is nutritional deficiencies. And when you're diabetic, the requirements for certain types of vitamins become much higher. So the B vitamins are usually in short supply when you're diabetic, because they're using them so much to make up for the damage of the diabetes.
You said B vitamins.
B vitamins, zinc, a lot of the things that the nerves require for normal functioning are one of the ones that are most commonly in deficiency for diabetes. Also, one of the things that can kick off diabetes is one of the most common things is the Coxsackie B virus. And the Coxsackie virus is the most common infection that gets into the nerves and causes peripheral neuropathy. So the Coxsackie virus can cause cardiomyopathy. Matter of fact, it's the only known cause of cardiomyopathy. It can also then attack the pancreas, one of the leading causes for type 1 diabetes. And then it also goes to the nervous system and starts to attack the nervous system.
This virus does.
This particular virus does. And so you have viral, that's very common with the diabetes. Then you also have all the nutritional deficiencies that occur with diabetes that affects the nerves. So you put that into it, and it's a perfect storm.
Wow. And we're talking about type 1 and type 2.
Type 1 and type 2, yes.
So how does diabetes affect the nerves?
Diabetes not only does, as we talked about, the nutritional deficiencies, also the virus itself that can kick off both of those, but also just the insulin. It's almost when you have the problems with the insulin and the glucose, it actually damages the nerves. You know, one of the things that occurs when you have diabetes, there's a whole deficiency that starts to occur on a cellular level, and the nerves are especially susceptible to that damage that occurs. There's free radical damage that starts to occur because of diabetes at a much higher rate, and it will affect the nerves and also start to affect the circulation too. So you get a lot of endothelial damage as you check on the arteries and measure that. That starts to occur, so then you start to have the whole circulatory problems. And if that becomes if you have a combination of both the circulation and the nerves starting to decrease their flow down into especially down into the feet, that's when you start to have some of the amputations that start to occur. Because the tissue starts to die. Because the nerves and the circulation is what is absolutely essential for the flesh to survive. So if you don't have that, then things start to degenerate quite quickly. And then you start to get the peripheral neuropathy with all the types of symptoms that start to occur, and then you start to get that damage.
Interesting. And so much of type 2 diabetes is preventable.
Yes. Type 2 diabetes is always reversible. Type 1 diabetes is something that really can't be brought back, but has to be you have to have insulin because the body's no longer able to produce it.
You're talking about type 1.
Type 1. But type 2 is something that if you do as you're supposed to do, do all the right things, you can always reverse type 2 diabetes.
Well, let's talk about, you talked about the B vitamins. Are there any other vitamins that are helpful in diabetic neuropathy? Sure.
When you're talking about the B vitamins, there are several that are very important. The thiamine, B1. Matter of fact, one of the things that if you have severe deficiency of B1, you develop something called beriberi, which...
That's a technical medical term. Beriberi.
It was something that was very common older. Now it's the full-blown isn't that well known. But if you have a deficiency of B1, that definitely starts to cause one of the symptoms is neuralgia. So a lot of people, once we can give them, with peripheral neuropathy, give them specifically the thiamine, we see some really dramatic changes that can occur. A lot of the pains in the feet start to go down. B6, pyridoxine, that also has a lot to do with neurotransmitters, and it is known as the nerve vitamin.
That was B6.
B6. Folacin, folic acid, folate, That is the most common deficiency in humans. And that has a big effect. Matter of fact, one of the FDA was really negative about vitamins, but now they require most foods to supplement with, that are processed, folic acid, because the major deficiency that almost everybody has.
Well, when women are pregnant, isn't that a requirement, folic acid?
Absolutely. That's something that the requirements go up, and usually they're deficient in, and that's what causes usually spina bifida. So there are birth defects that occur because of low folic acid, but folic acid can play a very big role in some of the neurological changes that occur along those lines. Niacin, B3, also causes the disease pellagra, which has one of the major things is neurological symptoms that occur with that. B12 can also be the deficiency, and that can be a direct cause of peripheral neuropathy.
So a deficiency in B12.
Yeah, so we've had patients who came in and we checked them out, and of course we can run all those vitamins. So we can do a vitamin test to see what people's deficiencies are, and then give those to them. And we had one lady, and she had been suffering with peripheral neuropathy, taking medication for it. And we said, well, you're just really deficient in B12. So we gave her B12 shots, and it was immediately afterwards that she says, my pain's gone.
Wow.
So, looking at those types of things, and when you're talking about peripheral neuropathy, nutrition is absolutely critical. If you are not being treated nutritionally for peripheral neuropathy, then you aren't being treated. So there's also vitamin E. The big thing with the vitamin E is the free radical pathology. That's especially important when you're talking about the circulatory part, because free radicals are one of the major reason for the loss of circulation down in the feet. And one of the things when you are diabetic and all the changes with the insulin and blood sugar, the process of oxidation in the body becomes way off, and free radicals become a huge problem. That's why nutrition is extremely important for diabetics. They need to really watch that, because their needs go up higher than the average person's. So, I mean, those are all the vitamins that go into peripheral neuropathy.
Okay. A lot of B vitamins
are really critical. They're known as the B vitamins are the nerve vitamins.
The nerve vitamins. All right, when we come back more on part 2 of peripheral neuropathy, causes and treatments.
You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. Dr. Prather, what is diathermy?
The way that we like to describe it to people is it's a large coiled magnet that produces a shortwave beam that goes into the body. The main thing that we like it is increasing circulation. The most common thing that we use it for is drainage of the ears, otitis media, the ear pain, the ear infections. For any mom who's been up with a little one screaming the entire night knows how wonderful it would be to get that under control.
Yeah.
I think about one little guy who's just starting to walk, and he had a terrible ear infection. The antibiotics, hadn't really kicked in or done anything at that point. They had heard that we do take care of otitis media, and that we could make a pretty quick cure. And the husband was a little bit skeptical, but they both came in, because Mom had been up all night and didn't want to drive in. And she looked like, help me. And the little guy was just, thrashing and in so much pain. So we brought him in, and 15 minutes on the diathermy. He was laughing and, looking around and waving at everybody. And
and they just kind of looked at me like, what the heck just happened? How did this occur? And we find that 15 minutes on the diathermy will just take away the pain, just like that. So it's something that is very easy to do, safe, very effective, and people just are amazed by the changes that occur in their sinuses and those eustachian tubes and in those ears. And moms can bring in, get their child done, and they're good.
Yeah, that child's not continually going on antibiotic after antibiotic, destroying their gut and their
weakening the immune system. You can cause too many antibiotic treatments can cause permanent damage to the immune system. Much better way of treatment is the diathermy unit. Anyone with any type of ear problems, ear infection, otitis media, going up into the sinuses and vertigo, also tinnitus. Extremely important for tinnitus. So any of our patients with tinnitus, the recommendations are always to have diathermy, because the diathermy does make an absolutely incredible difference with the tinnitus and getting that under control.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. A special message from the DTS Weight Loss Center at the Prather practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather practice. Dedicate, transform, succeed. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest.
Well, we're in a part 2 of a 2-part series, Peripheral Neuropathy, Causes and Treatments. And Dr. Prather, we kind of recapped, since this is part 2, in that first segment. But one thing you brought up that I wanted to ask you about is the vitamin testing that we do at the Prather practice. Can you talk a little bit more about that?
Yeah, it's a blood test, and we'll give you what you're deficient in, which is great. And with a diagnosis of peripheral neuropathy, that's a covered test, usually by insurances. So it's an excellent thing to do. And we're not just saying, well, we think that you're deficient on this.
We're guessing. There's no guessing.
There's no guessing.
Your blood's your blood.
Right. So it definitely shows up whether you have the problem or not, and then we can retest it and know when we've got it back to normal.
And what it's nice, this NutriVal, vitamin test, is covered by most insurances, which is great.
It is.
And it's very, very thorough on vitamin.
Yes.
Any vitamin deficiency and no guesswork.
Right.
Love that. So let's talk about why minerals. We talked about vitamins, but why are minerals important for diabetic neuropathy?
Well, the most important mineral that everybody agrees on is zinc. Zinc is critical for peripheral neuropathy. And if you have a deficiency in zinc, that can actually cause peripheral neuropathy. That's one of the things that has been shown to be very, very true. So, and I could think of 3 patients that what really made a difference in their peripheral neuropathy was zinc supplementation. Oftentimes, if the balance on that is between copper and zinc. So on these individuals, they had a high copper, which drives the zinc level down. And so we needed to, one, detox the copper and then increase the zinc, and it balances it out. If you're dealing with a electrician, if you're talking about electrical wires, and you put too much copper in a wire, it becomes too hot. Same thing is true for your nervous system. If the nerves have too much copper, not enough zinc, the nerves become hot and can cause pain, tingling, all sorts of different types of problems. Get the zinc level up and it slows it down, and you get better conduction through the nerves. So zinc is one of the critical things along those lines.
We're like an electrical
We
system.
We are. And zinc is also the most common deficiency in minerals. Now, there are other minerals. You have to look at the calcium, magnesium, all plays a role along those lines. And again, it's a balance as you're looking at this. Manganese also plays a very big role. And interestingly enough, zinc deficiency can lead to type 2 diabetes. It can kick that off, can be one of the causes. Zinc is absolutely critical for pancreatic function. And one of the things that occurs when you go into a diabetic situation, your requirements for zinc goes up tremendously. So you can see how that becomes a perfect storm for the zinc deficiency, and how that can really help out.
What about herbals? What herbals can be helpful in diabetic neuropathy?
Herbals. You're looking quite a bit of the herbals has to do with the antioxidant properties. So you've got the biggest thing with the herbals is how much it helps with the circulation. So like vitamin E is an antioxidant, and probably the major one that's involved with the keeping the oxidation levels of where it should be.
That's vitamin E.
Yeah, and vitamin E is very critical. Oh, and when we're talking about vitamin E is also probably the most important vitamin for peripheral neuropathy. So one of the common things, very common thing that I have is a referral from an oncologist who's treating someone for cancer, and they've developed peripheral neuropathy because of the chemo drugs. And vitamin E is the most critical thing that we provide for those patients, and that's where we get a tremendous amount of relief. And so, especially chemo-caused peripheral neuropathy, vitamin E is one of the things you think about quite a bit. And then we also are looking at the herbals for that particular type of peripheral neuropathy too. And one of my favorite one is bilberry. It's an excellent antioxidant and especially works on the circulation. So that's a very good one. Also, when you're talking about that, the pycnogenols is extremely helpful, and you can get that from grapeseed skin, the bark of a pine tree, also the from lime tree, some of the bark, and then leaves of the hazelnut tree are good ways to get the pycnogenol.
And I want to make sure people, don't pull off bark from a pine tree. It's not like you're eating bark.
Right. There's those are all processed, and those are different ways to get the pycnogenols in there. And the pycnogenols are excellent for
what are pycnogenols?
Well, it's a prosynological oligomers. PCOS
you even
for short.
had a hard time with that
one. But very similar to the actions of bilberry. So those are very, very excellent along those lines. Also, we do some superoxide dismutase, which is also excellent for the free radicals. There's another area that we look at.
So why is bilberry your favorite?
Bilberry just has great reactions. It's probably herbal. It's easily the best antioxidant, and we see the quickest changes on circulation with that particular product.
Is that in a liquid form? Or?
Yeah, you can get it in pill or liquid, but we usually use a liquid. It also helps, because of that, it helps with eyesight.
Oh, wow.
So you can start to have some damage with vision. A lot of people's, they start to need glasses after like chemo or things like that. There's a vision change. Put some bilberry in there, and it helps with the tingling and numbness in the feet, and then also brings the vision back.
Sounds like it would taste good, too.
Bilberry? Not really. But we also like ginkgo biloba, and we always combine that with folic acid. And it's very, very good for the vascular portion. Excellent along those lines. Now, you can also hit this in a lot of other different types of ways. If you're talking about the hyperglycemia, with the diabetes, that's another way of approaching some of the herbals. So aloe vera is excellent. That is very good for combating hyperglycemia. So I use that quite a bit to cut down on blood sugar. Also, if you use it topically for the diabetic wound healing, aloe vera works better than anything. So what you do is you get we actually have a cream that we recommend for that. They put it on there, and the people who have diabetic wounds say it heals quicker than anything else that they're doing.
Wow.
One of my favorite products is bitter melon, also known as balsam pear. It really helps with the glucose tolerance. So that's also
bitter melon.
Bitter melon.
Now that doesn't sound like that'll taste good.
Then also herbally, you can use cayenne pepper on a topical type of thing. And what it does is it causes some burning, but then it takes down the sensitivity. It seems to stop the sensitivity that occurs on the feet. So that's a topical cream that you can use. Fenugreek or Greek hay, glucose tolerance is excellent. Coccinia indica, which is Ayurvedic, great for glucose tolerance. And then good old garlic and onions. That's really a great one for helping out with diabetes. It has a high levels of sulfur, and that sulfur seems to be something that is really helpful along those lines.
The sulfur from
the sulfur
from the garlic and onion.
Sure. And then there's actually a whole bunch of other ones. Burdock root, dandelion root, Jerusalem artichoke, and I've got about 20 others that you could actually
And we
utilize.
carry all these at the Prather practice.
Yes, we have. If we don't have it right on, we can order it in. We have availability of 8,000 herbs that we can order.
But we have quite a
large yes,
natural pharmacy, and
right.
usually have what people need there. So
Right.
Yeah, very interesting, Dr. Prather. And that NutriVal, so that is one of the diagnostics that we do, covered by insurance, by most insurances, and can tell you exactly where the nutrition deficiencies are.
Right, which I don't like to guess.
Right.
I like to know.
Okay. We come back more on part 2 of peripheral neuropathy.
Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
If I'm diabetic, it's a cruel disease. You have to carry a candy bar with you wherever you go. You're not allowed to eat it. Unless you feel a coma coming on. After 8 years of no candy, I'm like, come on, coma.
Have you ever been curious about how acupuncture can benefit your health? The Prather practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue.
We're in part 2 of a 2-part series on peripheral neuropathy and causes and treatments. And we just got done in the last segment talking about diabetic neuropathy, which is, there's a lot of different causes, right, of peripheral neuropathy, but diabetes type 1 and type 2 being one of the major things. But let's talk about, Dr. Prather, why is circulation important to peripheral neuropathy?
Well, that's one of the major causes of peripheral neuropathy. It's not just the nervous system, which is critical, but you have to look at the circulatory. And oftentimes when you have damage to the nervous system, you're also going to have damage to the circulatory system. We have had people who were diagnosed with peripheral neuropathy that had very little involvement in the nerves. It's a little bit rare. Usually we have both. But approaching it from the, a matter of fact, there's several different types of medications that you can use for peripheral neuropathy that are designed those lines, but they all work on the nervous system. So this person, they hadn't determined that it was mainly circulatory, not neurological, and so none of the medications were obviously working. So we started a program on the circulation along with some therapies to increase circulation, and got really, really excellent results. Matter of fact, one of the things I would like to point out, there are quite a few medications for that, but they never reverse it. And understanding the difference again about structure function versus pharmaceutical. Pharmaceutical is only for the symptomatology, and so especially as you're dealing with neuropathy, if you're just depending on pharmaceuticals, you're never going to get better. Because pharmaceuticals aren't designed to make you better. They're designed to help with the symptomatology, which is important, and you can get some help that way. But if you really want to get over it, you have to go to structure function care, and that's, of course, what we're talking about here. And the results that you get from structure function care are far, far greater than you can get pharmaceutically.
Yeah, I mean, we see it all the time.
Yes.
We see it all the time.
We get a lot of referrals for neuropathy. The reason is of course, the poor results pharmaceutically.
So what major complications occur in circulation with peripheral neuropathy?
Well, you start to have tissue damage that starts to occur, then you start to get the sores because the flesh can actually start to rot. Because you're just not getting the nutrients down there. So people who are coming in, I always hate to see people who arrive into my office and have already lost part of their foot, or toes or things like that, because
or even the sores.
The sores, because those can be definitely fixed if we can get that before you get to that point. Which I've had several people say, well, I wish I knew to approach this before this occurred.
Right.
I've had patients who came in who were scheduled for amputations, and we started the work, and in a relatively short amount of time, the vascular surgeon said, "Wow, you got better circulation than I do now."
And they didn't need the surgery.
They didn't need the surgery at that
Wow.
point. So, looking at that, treating it accordingly, going after that, knowing what to do with the whole process on that, you can get that reversed and really prevent some huge problems.
Well, I'm sure every listener that's listening to this program knows somebody with neuropathy,
Right.
with over 20 million people
Who are diagnosed with that, right?
Yes.
And it is when we, one of the things as I'm getting patients in, is we don't wait until they're diagnosed with it. We do some pre-screenings, and I say, hey, you are at risk for peripheral neuropathy from the things that I see on this. We need to start a program now, get that taken care of, so that doesn't become a problem.
Well, so every diabetic should have that pre-screening, right?
Absolutely.
What other things would,
Kind of.
yeah.
One of the things is, of course, just getting older. So,
Which we all do.
right.
Darn it.
The test that we do is actually encouraged by Medicare. So anyone who is already on
The
Medicare,
NutriVal.
not just the NutriVal, but it is covered by that. But the screening for the peripheral neuropathy.
Okay.
It's the insurance companies like us to catch it before it becomes a problem because it's very expensive and can lead to a shortening of lifespan and a whole host of health problems. So Medicare encourages that as a yearly screening just to see. So it is something that is encouraged to be screened. We try to screen, if you're over 50, you should be screened for it.
Okay. So anybody over 50.
50, just to make sure that that's not an issue.
And you do the screening at the Prather practice.
We do that, yes.
Okay, great. So let's talk about, you've been bringing up free radicals. And what are free radicals? I always think of a rock band, heavy metal rock band.
Wouldn't
That'd
that
be a good name.
That'd be a great name. Some kid
Free
out
the
there.
radicals.
Well, it's not some long-haired group at the colleges, and of course they could talk about antioxidants and free radicals are electrons that are kicked off by oxygen molecules.
Okay.
So those go around and start to cause damage throughout the body, can cause damage in the arteries, nerves. Free radicals, there's the theory of free radicals for cardiovascular disease as one of the major causes, which is true. Also for cancer, can kick off cancer. One of the things is they talk about the age spots on the skin. That's a sign of free radical damage. Matter of fact, if you had no free radical damage in your body, you would look like 21 the rest of your life. It's part of the thing that causes aging. Another thing that you can relate that to is on a piece of metal. When it starts to rust, that's free radical damage.
Oh, fun.
So when I sit there and I says you have a high level of free radical damage, and I use that illustration, they said, "You mean I'm starting to get rusty?" And that's actually true. But when you're making energy, you need it's called the oxidative process. And if it's not firing on all cylinders, then you start to develop some free radicals. The electrons get kicked off because the mechanism isn't going well. And it is very, very dependent on vitamins and nutrients and fatty acids to work properly. So one of the things that occurs is nutritional deficiencies. And those nutritional deficiencies can lead to free radical damage because the process isn't working. So, and then you use, one of the things that's interesting is one of the major ways that the body tries to fight free radicals is cholesterol.
Oh.
Because cholesterol is something that the body uses to absorb free radicals and then make them inert. So one of the things that we do is we give different types of nutrients and stop the free radical pathology, then all of a sudden people's cholesterol levels drop down to normal.
Interesting.
So one of the things is if you take cholesterol medicine and you're trying to fight free radical damage, you can actually speed up cardiovascular disease, because then the free radicals are actually, because our theory of high cholesterol is it's a symptom, not a disease.
Right.
So you really don't do any good just by lowering your cholesterol, because the cholesterol is more of a response, not a cause.
We need to do a cholesterol show.
Yeah.
Yeah. Yeah, I love when we do the cholesterol show. It just makes total sense.
Oh, well, one of the things is too low of cholesterol can actually kick off peripheral neuropathy.
Too low of cholesterol.
Yes, if you go below 120 on your cholesterol as an adult, then that can be one of the causes of peripheral neuropathy, because the nerves are made of cholesterol.
Interesting. Well, can medications cause peripheral neuropathy?
Yes.
You talked about chemo.
Chemo is very well known. An antibiotic can do it. You can also get a vaccination and all of a sudden develop some peripheral neuropathy. I've had several patients, Guillain-Barré. Of course, there are probably 200 known medications that have been shown to kick off peripheral neuropathy.
200, wow.
Yeah.
Interesting.
So that is one thing that we always look at. And I had a patient who came in who had started on some blood pressure medicine, and all of a sudden, combination of two medications, and one of the known effects was peripheral neuropathy. And he was he says, I've been going through this, and nobody knew what the cause was, and it was the medications that I was on. And, of course, one of the things is we had him stop we talked to his doctor who had prescribed it, and had talked to him about the problem, and we had switched medications, and then we could make progress on him. While he was taking those medications, we were making no progress on his peripheral neuropathy, because we were fighting against the medication. So we looked at that, figured it out, and got him off of that, and we've really made a big difference.
Interesting. Very interesting. When we come back, let's talk about gut health and peripheral neuropathy.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Why did you incorporate massage into your practice?
I believe that massage is an extremely important part of one's wellness, health regimen. It's something that everyone should have done at least once a month, if not more often, just to maintain a good, healthy type of a program in their system. As you work with the muscles and the soft tissue, you can actually create a tremendous amount of changes that occur. There are hormonal changes, there are physiological changes on balance. It's a very important part of one's health and wellness.
Yeah, it's much more than
And
just
it feels
feeling
good.
good. Well, it feels good, yeah. It's a lot more. What types of massage services do you do at your office?
Well, interestingly enough, there are a lot of different ways that massage actually can be involved in someone's health, and people don't realize how many types of massage there actually are. There's lymphatic, there's muscle, there's deep muscle, there's reflexology, there's electromagnetic, there's neurological, there's ones that can actually wake you up, some that can relax you, some that can balance out your emotional states. So there's a tremendous amount of different types of massage that can be affected on your system.
And who would benefit from massage?
Everyone. But if you have tight muscles, and I'm sure most people out there don't, a higher than average stress level, then massage can really prolong your life, reduce your blood pressure, increase your chances of preventing cardiovascular and cancer, especially if you're in a high-stress position. Definitely take the time out for massage.
Here we have member pricing for our spa services for once-a-month massage at $59 a month.
Wow.
Which is great.
That is good.
Our massage therapist, we have from 11 years experience to 25 years experience with our massage therapist. So,
Yeah.
and there's nowhere else in town that you can get that kind of quality, massage for that price.
It is a medical level massage at that's a very good price.
$59.
Yeah, we also have a medical doctor on staff, nurse practitioner, chiropractic, acupuncture. We have all the diagnostics here so that, you can feel very assured that you have the support, of a whole healthcare professional team that is behind the massage therapist too.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Don't stop believing. Hold on to that feeling, yeah. Street lights.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients.
Well, we're in part 2 of a 2-part series on peripheral neuropathy. And Dr. Prather, let's talk about gut health. Why is gut health so important to peripheral neuropathy?
Well, gut health has a big determination on free radical pathology. That can really kick off quite a bit. Also on the absorption of your nutrients. And then also there's quite a few infections that can be in there. So looking at the gut health can play direct results on the peripheral neuropathy.
Now, infections can cause peripheral neuropathy?
Yes.
Okay.
Yeah. There are different bacteria, viruses, parasites, and 80% of your immune system is around the gut.
80%.
80%. So 80% of your infections come from the gut. Diagnosing and looking at what's going on with the gut health is one of the critical things. It can also point out whether you have a leaky gut syndrome, diagnose that, and with that you can have quite a bit of food allergies. So food allergies is also another thing that can play a big role in peripheral neuropathy and make a big change. So you're talking about all the different types of factors that go into peripheral neuropathy. You're talking about vitamin and nutrient deficiencies. If you have an insufficient pancreas, where you're not getting the pancreatic enzymes into your digestive tract to absorb, you can't absorb zinc. So, that would show up as you analyze the gut. You've got all the infections that can be playing a big role. So looking at that, so you've got the nutrients, you've got the infections, and you also have free radical pathology that can be created in the gut.
There is a lot involved with
There's a lot
peripheral
involved.
neuropathy.
There's a lot involved, and that it's a complicated type of an area, and it's not just a one cure, but it's basically you have to really be an investigator to go after this.
So can peripheral neuropathy be inherited?
It can. There seems to, if you have a brother, sister, or parents or grandparents that had peripheral neuropathy, your chances increase quite a bit. So there does seem to be a definite inherited tendency towards peripheral neuropathy over than someone else.
And you talked about at the Prather practice we do a peripheral neuropathy screening.
We do.
And very important, you said anybody over the age of 50.
Right. That's something that we recommend quite a bit, especially if we see any types of signs, symptoms. If we're starting to see some foot pain involved in it, I want to know why and get that checked out.
Well, what role, we talked about, vitamin deficiencies, those B vitamins play a big role in neuropathy. Talked about herbals. What about homeopathy? What role does that play in treating peripheral neuropathy?
Homeopathy is probably our secret weapon that's not available to a lot of people. There are some specific homeopathics that have a direct result on that. And then also, especially as you're talking about any type of a situation where you're talking about infections, infections has a direct result. Homeopathy can really help the body zoom in on which infections and get the body to become much more specific. You have two different types of immune systems. You have T cell and B cell, and T cells help with the specificity of the T cells to kind of get that honed in. So as you have, if we're determining that the Coxsackie virus has a lot to do with it, we will make a homeopathic for the Coxsackie. Then all of a sudden we start to see the blood sugar start to get better. We start to see the neuropathy starting to get better. And what we've done is we've stimulated the T cells to start to go after the Coxsackie so that it's not, so we start to get some results. So how you can help with the immune system is to get it more specific. The more specific the immune system is, the better it is. The more unspecific it is, which is more of a B cell, the B52 bombers, the more problems then you have a lot of the autoimmune types of reactions.
Okay. Well, let's talk. We just have a couple more minutes left. Lifestyle changes, that are important to help prevent peripheral neuropathy. Smoking causes a big problem.
Huge issue with free radical pathology. It also uses up the B vitamins and zinc. So if you smoke, you have a higher nutritional requirements because it really sets things off, and then also cuts down on the circulation because of the free radical pathology.
Interesting.
Smoking is just awful for peripheral neuropathy, and can be something that completely causes it.
Yeah. That's interesting because you said it depletes zinc, which you need, and increases the free radicals. What about obesity?
Yes, and obesity, again, you have a greater, you have higher free radicals if your fat percentage is too high. It also throws off how the whole body works, puts a greater requirements on the insulin and on the pancreas, can actually lead to type 2 diabetes, and decreases your immune system. Besides that, it's not bad.
And we have a great weight loss program at the Prather practice, and we've seen type 2 diabetics get off their insulin through this weight loss program, which has been really encouraging. Well, thank you, Dr. Prather. Very informative.
Well, thank you, Lisa. I enjoyed myself.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.